So this is part 1 of our presentation on surgical instruments. You can operate only once you get a good field of view of the area that you are going to operate. And speculums and retractors are needed to provide you just that. So I'll be starting with speculums and retractors. But before you put a speculum and retractor, you need to put an eye drape. So you would have seen in the OT of your own hospital that there are two types of eye drapes. One is made of fabric and the other one is made of polyethylene, the kind you are seeing here. So whenever we clean a patient with betadine and we let it dry, after that we put a fabric drape. And on top of that, you put a plastic drape. It's never the other way around because we don't want the drape to get wet. Any wet surface would invite microbes. So we don't want it to get wet. We want an impervious coating, draping whenever we are starting the surgery. So cleaning with betadine, followed by drying of that area, followed by a fabric drape, and followed by a final plastic drape. So that's the pocket which collects the fluid. Always remember it whenever you're opening the drape that the fluid should, there is a marking on the drape that the fluid should get collected on the side where, which is the dependent side, where on the temporal part. So if I had opened it wrong, this would have come on the nasal side and then it would have been a waste of the drape. So always look at this marking, which side it would open. It should be on the temporal side of the eye that is to be operated. So here's looking at a few speculums. A speculum would separate the eyelids during the ophthalmic procedure. It can be a minor OT procedure or it can be a major surgery. Wherever we use the word universal for a speculum, it means that it can be used either for the right eye or the left eye. There are certain speculums which are designed for right eye or left eye separately. So universal means you can use it for either eye. When we say an unguarded speculum, it means eyelashes can project into the operating field. Now, if you see, this is a wire speculum, but there's no guard here. So eyelash in this area can pop out in the surgical scenario. Unlike this, which is guarded, which has a steel plate. So when this is applied to the eyelids, the eyelashes in this area will not come in the surgical field. So unguarded and guarded. And then we have adjustable speculums which have a screw handle, just like here. You can adjust how much palpebral aperture you want to be opened up. So this allows you to control the amount of separation of the eyelids. Always remember the screw handle is on the temporal side so that it doesn't disturb the surgical field. This instrument, this is one of the most easily available, most commonly used speculum. This is called as Kratz backwards lid speculum, or you can just call it backwards lid speculum. That would be good enough. It is applied for during a cataract surgery, which is done most commonly. It is also applied during minor OT procedures when you're trying to wash a patient's eye following a chemical injury, or when you are just trying to suture a small conjunctival laceration. As you can see, it's a wired speculum. There is no screw, so it is not adjustable and it does not have a plate. So it is unguarded. So some amount of cilia or eyelashes can protrude through. That's the disadvantage of this. But otherwise, it is a lightweight suture. It does not apply, it's a lightweight speculum and it does not apply pressure on the globe. Now, many a times we get patients following roadside accidents where a piece of glass had entered their eye and the corneal laceration is there and it's an open globe injury. Now, to such a patient, when you are operating, you apply a speculum which is putting a lot of pressure on the globe, then there can be expulsion of the intraocular contents. So you don't want that. So in those cases, such type of a Baracker's lid speculum was a preferable speculum to use. The adult size speculum is about 14 millimeters. The pediatric size speculum is about 12 millimeters. It gives you about good 22 to 25 millimeters separation of the eyelids, which is good enough to do most surgical procedures. The next speculum is Williams lid speculum. See, there is a screw here that allows it to be self-retaining. Once you have screwed it in a particular position, it will stay like that. Unplated, there is no plate, so cilia can escape, but the speculum itself looks wide enough. So in certain surgical procedures where you want a very wide exposure, this is one of the best speculums to consider. In squint surgery, when you want to bridle the muscles, or if you're doing scleral buckling surgery, where you want a wider exposure and you want to bridle all the four muscles, or when you're doing enucleation, that is removal of the eyeball in cases where you want to take a corneal donation or in certain tumors, then this speculum comes in really handy because of its wide exposure of the palpebral aperture. It is self-retaining, self-locking. It is curved in a way to follow the contour of the eye. It is universal. It can be used for both the eyes. And with the screw, you can control the amount of retraction. But see, since it's bulky in size, it's bigger, it causes some pressure on the globe, and that can lead to rise in intraocular pressure. And, especially in open globe cases, this should be avoided. There are certain other forms of speculum, adjustable or non-adjustable. The names are given just to complete the list, but most centers would put the ones that I have talked about during their instrument viva. These speculums that are listed here are just for completion's sake. They are usually not kept during the case vivas. Now, sometimes you don't need a speculum. You need a retractor, especially in cases where we are dealing with a child. The child does not allow you examination, and it will not allow you to definitely put a speculum. And you want to see if there is anything which is bothering their eye or cornea, or if there is something under the palpebral conjunctiva. Then we get to use DMARS lid retractor. The S is silent. This is how the instrument looks like. It has a saddle-shaped curve. Its horizontal width depends upon the size of the lid retractor that you're using. It comes from size 0 to size 3, 0 being 11, 1 being 13, and 2 being 15 and 3 being 17. So odd numbers 11, 13, 15, 17 to memorize quickly. Whenever somebody has a blepharospasm, by blepharospasm we mean that there is such tight clenching of the eyelid and the patient is not allowing you to examine. Many a times people have foreign body on the surface of their cornea, and that has resulted in a corneal epithelial defect, and because of that epithelial defect, people get all sorts of symptoms like watering, glare, photophobia, blepharospasm, and they're not able to open their eye. So how will you examine and assess the amount of corneal damage? So on all those cases where there is blepharospasm, lid retractor comes in handy. In children where there is conjunctivitis or there is marked chemosis or marked swelling of the eyelid, then also the eyelid is shut tight. So you need to use 2 retractors to open the upper and the lower eyelids so as to examine the globe.